Hi, everyone. So, on the series that we're going to continue to really hit 2024 with health preventative tips and just get to be the best possible, healthiest we can be. And I wanted to talk about the elective procedures and the risk of anesthesia because I'll have patients ask me, do you think I should get that eye lift or the partial facelift? Or I don't know if I should get knee surgery before they've exhausted every other realm possible. As my husband always tells me, and he's a physical therapist, that surgery should always be the last resort. So if you have an injured knee, hip, back, you exhaust everything: weight loss, nutrition, avoiding sugar, swimming, weight-bearing exercise, physical therapy, whatever's available for the injury. You exhaust everything first, medication even, before going to surgery. But I wanted to highlight something else because this is something we've all probably been offered or had, and that's anesthesia. So whether you go to the dentist and you're offered, like, do you want to be all the way out for this procedure? Or if you're going for an elective procedure like cosmetic and you get put under general anesthesia, I don't think patients are fully aware of the risks of that. And so I wanted to talk about that today because one of the risks, and on my prior videos, was staying out of the nursing home, right? So one of the risks is dementia. So the National Institutes of Health, because, I've got to back this up with facts, right? The National Institutes of Health said exposure to anesthesia at least twice in a year can give the patient a 1.75-fold increased risk of dementia. Whereas exposure to anesthesia only once a year yielded the 1.73-fold increased risk of dementia, which that's not a big difference. Yeah, it went up a little bit if twice a year, but even once a year increased it. And I was just like, okay, that's not good. So why does that happen? Well, when you're under anesthesia, it is a toxin in your body. It has to get rid of it. Sometimes the brain does not get enough oxygen to it. Blood pressure and heart rate can go down. There's a lot of things that can happen with anesthesia on the brain. And people can come out of that also because it is kind of a brain injury. A low level, but it is a brain injury, being under that much anesthetic. People can have like long-term cognitive difficulties, problems doing specific mental activities, whether it's, math, accounting, things that you really need your mental faculties for. And did you know also, the more times you're under general anesthetic, the more your lifetime total risk mortality goes up. So you're more likely to die. Those have been under repeated anesthesia. And so if you're given, in my opinion, what can you do about this? Well, I think, I know with my dentist, I don't ever want to be out. I always am just given a local, yeah, I can hear everything going on. But I would rather trade the risk of hearing all that going on, it's a little bit stressful, than being put out, because I don't want to do that to my brain. And I just wanted to share that you had that information. I know sometimes we need surgeries and you might need to go under anesthesia, but here's some things you can do to mitigate your risk also. So I wanted to talk about this celebrity. Her name is Julia Fox. I didn't know who she was. Apparently she dated Kanye West for a while. But so she talks about actually waking up during her surgery. So she was still paralyzed, but the part of the anesthetic that keeps you under or asleep had worn off. And she explains what happened was she was out all night long, drinking, intoxicated, and didn't get home until 6 a.m. Her appointment was at 9, and she even got there an hour late for her nose job at 10 a.m. Underwent her nose job surgery, which, by the way, blows my mind too, because I know when I used to work in the hospital, we would do a pre-surgical checklist. You had to be, no food for 24 hours. Yes, you could drink water, but fasting after midnight. Like, we were really strict about pre-op checklists. Like, you couldn't have had blood thinners, where alcohol is a blood thinner. There was all these things we'd have to check off. And if the patient didn't follow the guidelines, we postponed surgery. So I don't know how they still went on with her nose job. They had to have smelled the alcohol coming out of her pores. So I don't know. But obviously, I don't know where she had this done, but she said, this is a quote, "I had so much alcohol in my blood that the anesthetic wasn't working. So I woke up mid-procedure. I could hear them breaking my bone." She said, "I was like paralyzed, but I was trying to tell them that I was awake. It was actually really traumatic, but totally my fault." That's a quote from her. So, I mean, that's just a harrowing experience. And she said she was trying to signal to them that she was awake, yet she couldn't move. And, that's kind of my worst nightmare also. I'm sure a lot of people are worried about that too. But what could she have done? Well, maybe follow the guidelines pre-op. So if you're going to go pre-surgery, follow all the conditions. No aspirin, no alcohol, no blood thinners. There's certain vitamins they'll put on your list that you cannot take, like vitamin E. Even vitamin C can mess up lab work in case they want to do pre and post lab work before. And even herbs like St. John's wort can affect blood thinning, ginkgo biloba. There's a whole list of things that can affect how thin your blood is, which you don't want thin blood during surgery. You don't want thick blood either. You just want it normal. And I think even say if you have a surgery coming up that you're going to be under anesthesia, get your brain as in shape as possible. Be taking those omega-3 fish oils or flax oil. What's good for the brain? You can look at brain supplements, but Bacopa monnieri, ginkgo biloba, phosphatidylserine, and choline. Now again, some of those are blood thinners, so you can't take them all the way up to surgery. But there's so many good things you can do for your brain, or just good nutrition. Like for a month prior, avoiding sugar, just eating whole, good, natural, high fiber fruits and vegetables. Get walking every day. Get that sunshine. Get your body in the best health possible. Even milk thistle to really prepare the liver for getting rid of the anesthesia post-op. I mean, there's things I think you can do to get your body as ready as it can, almost like Teflon for anesthesia. Now, your body is still going to have to deal with the effects of anesthesia, but I think if you're in as good of a position as possible. Now, I also wanted to talk about, let me find the article, on Joan Rivers, what happened to her. Well, apparently she did go under surgery. She was having a procedure done on her throat, and I love Joan Rivers. I was a fan. I thought she was hilarious, and why? Because she was so real. She didn't try to be anybody else or put on a fake persona. It was just her. So I think that's why I kind of liked her, especially when she was on the E channel and she would do like the fashion comments. I kind of missed that. But what I was reading was that her blood pressure and heart rate decreased during her elective surgery so much that her brain lost oxygen. And long story short, she was sent to the hospital and then did not survive. And again, I don't know the specifics of how much anesthesia she went. Apparently it was a minor elective surgery. Could she have been given too much anesthesia? Maybe, but maybe she was given the normal amount. But for someone at that time, I believe she was in her 80s when she had this done. I don't know what her health was prior, but that's the thing. It's like you get to a certain age and going under anesthesia becomes very, very risky. I know I was talking to another patient of mine who had some minor thing going on, but she's in her 80s, and we together decided, you know what? Let's just deal with that problem and not risk going under anesthesia, because I think you always have to choose between your risks, the good and the evil, between, what's going up, the risks versus the benefits. You always have to weigh that. And so, so I just thought that was really important as we go into 2024 and we're thinking of, what things do we want to do this year for us? I just wanted you all aware of that in case your doctor hasn't talked to you about that yet. I want to thank you for being here for this video. I'm going to try to put out another one each day for just getting ready for the new year and getting as healthy as we can naturally. I'll see you on the next one.